Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It's worrisome that polio can come back. It's worrisome that there may be folks in this day and age of vaccine hesitancy and anti-vaxxing that may refrain from giving their children the polio vaccine. That's how viruses come back. Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's great podcasts. We have so many to choose from.
We sure do, and you can check them all out at ghlf.org/listen. This week, we'll give a shout out to Talking Head Pain, a podcast for people living with headache and migraine and their caregivers as well. Definitely listen in as Joe speaks to migraine advocates about their experiences.
Love his podcast, and I love Joe.
So let's give another shout out. Are you ready for a listener comment?
I am ready.
This one is from Lynn, who wrote, "This podcast is super interesting and just the right length."
Well, thank you, Lynn.
Perhaps the biggest news of the week is that the Senate passes the bill focused on climate change, tax, and healthcare. So I thought we could dive into what this means for healthcare.
Originally, this was the Build Back Better legislation that we've spoken about in past podcasts. That legislation, we thought, was dead in the water. However, it seemed to have been revitalized and came back in a new form. Is Frankenstein a good example? Who's the one that dies and never comes back? That's a few of them, right?
Yeah.
Zombie legislation. That's what it is. Zombie legislation. It has reappeared as Inflation Reduction Act of 2022.
Although it's scaled down, it is how progress is made in Washington. I feel like we talk about this a lot, that progress is slow and it often involves a lot of compromise. So it's still good, even though it's scaled back.
Absolutely.
So the first big thing is negotiating prices. So for the first time, Medicare would be allowed to negotiate with drug makers on the price of prescription drugs. And this is projected to save the federal government billions of dollars. But hopefully this is going to help bring down the cost of healthcare for patients.
And the savings will go to Medicare. It would apply to 10 drugs initially, beginning in 2026, and then expand to include more drugs in the following year. It should be noted that the Congressional Budget Office, as well as opponents of this provision, have said that this plan would stifle innovation and the development of new drugs.
From my perspective, it's good to have some change because we hear from patients all the time on Medicare about how the system isn't working for them. So I'm excited to see some sort of change coming out of this. Another thing to look forward to in the coming years, effective in 2025, there's going to be a cap on out-of-pocket costs that seniors pay annually for prescriptions. So that'll be capped at $2,000. And the bill will also ensure that seniors have free access to vaccines.
There's also a cap on insulin. When the bill was originally reproposed, there was a $35 cap on insulin for all patients. However, in the final stages of the vote, the $35 cap was removed for patients on private insurance, but does remain for Medicare patients. Again, we, and I say we, I'm referring to GHLF, we are very optimistic about this portion of the bill. The $35 cap for insulin is great. We would have liked to have seen it for all patients. But again, now we've sort of moved the goalposts and said, okay, we got the $35 cap for Medicare patients. Now let's keep going and get it for private insurance patients.
And then the last piece of this is the subsidies. So the legislation broadens the subsidies available under the Affordable Care Act for another 3 years.
Which is great because a few weeks ago, the government announced that there are the lowest percentage of uninsured Americans at any time for the last 50 years. So it's great to see that more and more Americans are obtaining insurance, which is always the first stopgap measure in healthcare.
And for our community that relies so heavily on insurance to help get access to doctors, this is good news that it'll be more affordable.
Some other good news is the Novavax COVID-19 vaccine has had its rollout. It's off to a slow start, unfortunately, but it is out there. As a reminder, the Novavax COVID vaccine got emergency use authorization last month.
So with this slow rollout, I want to look at the numbers a bit, and I saw that there's more than 26 million American adults who remain unvaccinated. And, we're hoping that this Novavax vaccine could have been appealing to this group because it's different than the other ones out there, but only 7,300 doses have been administered to Americans, which is pretty small.
Some reasons for the slow start include the vaccines weren't immediately available after the authorization, and so there may have been some reporting delays. The vaccine also has not been widely available. There are just 385 sites initially that were offering the Novavax vaccine. Hopefully that number is starting to tick up. It's now offered at almost 1,000 sites around the country. So hopefully we'll see some progress. As we've spoken about before, the window of folks who are unvaccinated but willing to take the Novavax vaccine rather than the mRNA, it was a small slice. So most of those unvaccinated are unvaccinated for other reasons.
I guess the good news buried in all this is that the numbers are going up of its availability. So hopefully we'll see vaccination rates go up too.
Other news, health officials in New York State have discovered a case of polio in an adult, the first case in the United States since 2013.
This was jarring. We have COVID, we have monkeypox, now we're talking about polio. Let's dive into this. What's happening and what do we know?
Polio is an infectious disease caused by a virus that can spread from person to person and cause paralysis.
What's interesting about it is most people who get infected don't have any visible symptoms. Like 1 out of 4 people have flu-like symptoms, and then a smaller proportion will have this more serious symptoms that affect the brain and spinal cord. And it's when you don't catch it because you're not having symptoms is that then it becomes a problem.
So let's talk about what's happening with polio. Earlier this summer, British health authorities announced that they found evidence suggesting local spread of polio in London. And it should be noted that the country was declared polio-free in 2003.
In this instance, no one had turned up sick. The proof just came from routine tests of sewage samples. These routine tests, we're doing them with COVID now. We test the water and they can just alert health officials that a virus is circulating and allow them to intervene quicker in a more preventative way. What happened in London when they found this is that they reached out to families with young kids to make sure they're vaccinated as a preventative measure.
Now, things are a bit different here. In the United States, a young man in Rockland County in New York sought medical treatment for weakness and paralysis in June. By the time the tests confirmed he had polio, nearly a month had passed. After this case appeared, New York State health officials started testing wastewater samples from Rockland County and surrounding counties to help determine if the virus is spreading elsewhere.
I was wondering, why did it take this man having to come in? But since polio has, for the most part, been eradicated, it's like the cost outweighs the benefit of testing the waters because we have such high vaccination rates and the risk of spreading disease is really low. So we've been testing for other diseases like COVID, but not necessarily polio.
So wasn't polio eradicated?
Yeah. In 1988, we had a huge effort to eradicate polio. This was the Global Polio Eradication Initiative, and it really focused on vaccination. We have to get vaccines into people and also surveillance around the world, see where it's traveling, test the water, stuff like that. And it was a really, really successful campaign. Polio has more or less been eradicated across the globe. It remains in impoverished countries that struggle with vaccination rates and clean water. So most commonly you'll hear about polio in Afghanistan or Pakistan, but for the most part, we've really gotten rid of it. So, that begs the question, how did it come back?
I guess it just speaks to the idea, as much as you can eradicate a disease, if you don't stay vigilant, if you don't keep up with the vaccinations, and if you're not so robust in a worldwide vaccination effort, there's always a risk of it returning. And in this particular instance, we don't know what happened with this individual. We do know that this particular person had traveled extensively, but we don't know the specifics of this case. So we're still trying to learn what's going on here and what's going on elsewhere. I just want to pause here and say that most adults, and I'm talking well north of 90% of adults, do not need to worry about polio. It's not something to worry about. If you have been vaccinated, you are fine. If by chance you happen to be traveling to a country that potentially might have cases such as Afghanistan or Pakistan, talk to your doctor, although you're probably going to want to talk to your doctor about other viruses that might be circulating there as well. But in the United States, if you have been vaccinated, there really is no cause to worry. It's worrisome that polio can come back. It's worrisome that there may be folks in this day and age of vaccine hesitancy and anti-vaxxing that may refrain from giving their children the polio vaccine. That's how viruses come back. It is like a zombie. You can't just sit back and let it die. You have to stay on top of it.
It's comforting what you said that most people don't need to worry because, most children have been vaccinated by the age of 2. I actually checked my vaccine records to double check that I have, and I have, which felt good. So, if you're worried, just double check your records. You can also continue hand washing, the mitigation efforts that we've already been doing, keep up with them and practice, social hygiene to keep yourself safe. But there's really should be very little worry when it comes to polio.
And I have to say, the polio vaccine is one of the great success stories. There were 2 doctors who developed them separately, Dr. Sabin and more famously, Dr. Jonas Salk. He never got rich off the polio vaccine. He worked diligently, created the vaccine, did a world of wonder for public health, which is really fantastic. And also, I should mention, pharmaceutical companies got together and they worked in tandem to produce and distribute these vaccines.
You walk into public health school, and this is one of the first things that they bring up is how successful of a public health campaign this is. Let's model campaigns after this because it has been such a success. So when we think what's there to worry about, not much. One last thought, I was thinking about how polio is so visible if you do get the impact or you're paralyzed from it, as opposed to COVID, which really isn't visible. And I think there's such a component there with, encouraging people to get the vaccine and protect against this. Well, Steven, that brings us to the close of our show. What did you learn today?
I learned about the recurrence of polio and how scary it is that diseases that we thought had been eradicated or nearly eradicated can come back.
And I learned from you at the top of the episode about, the new healthcare bill that's hopefully going to pass.
Well, we hope that you learned something too. We'd love to hear from you about your advocacy stories. Send your email to thehealthadvocates@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also email us if you want to subscribe to our weekly newsletter where we share the top health news of the week.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts. And hit that subscribe button wherever you listen so you never miss an episode. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.